Today's topic: iodine and fluorine. Iodine. Dietary sources include seafood, very rich source of iodine, such as sea fish and cod liver oil. Iodine contents decrease in the region away from shores. Upper region of mountains generally contains less iodine. Such areas called goitrous belts, for example, Himalayan regions. Now recommended daily allowances. Infants required 40 to 50 micrograms per day. Children required 70 to 120 micrograms per day. Adults required 150 micrograms per day. And pregnant women required 175 micrograms. And lactating women required 200 micrograms per day. Now body distribution. Total iodine contents exist in our body up to 20 to 30 milligrams. 20% found in thyroid gland. Thyroid iodide occurs in three forms. Thyroid iodine occurs in three forms. Number one, 1% as iodide ions, 20 to 25% incorporated in thyroid hormones. And number three, rest of it occur as organic precursor of thyroid hormones known as thyroglobulin. Now plasma iodine exists in two forms, inorganic or ionic form. In iodide form, 5% of total plasma iodine, about 0.3 to 0.5 microgram per deciliter. Number two, organic or hormonal iodine is a part of thyroid hormone molecule which bound with specific plasma proteins. Absorption and excretion. Iodine in the diet absorbed rapidly in the form of iodide form from small intestine. Normally, about one-third of dietary iodine is taken up by the thyroid gland and a little iodine is taken up by mammary and salivary glands. The rest is excreted by the kidneys. Kidney excreted about 70 to 80%. Small amounts are excreted through bile, skin, and saliva. Milk of lactating women also contains some iodine. Now functions. Most important role of iodine in the synthesis of thyroid hormones. Triiodothyroxine and tetraiodothyroxine, which influence a large number of metabolic functions. Deficiency manifestations. Deficiency of iodine occurs in several regions of the world where the iodine contents of soil and therefore of plants is low. अगर आयोडीन की डेफिशिएंसी चिल्ड्रंस में हो जाए तो ये क्रेटिनिज्म कहलाती और अगर एडल्ट्स में हो तो गोइटर. क्रेटिनिज्म. A severe iodine deficiency in mothers leads to intrauterine or neonatal hypothyroidism, results in cretinism in their children, a condition that characterized by a mental retardation, slow body development, dwarfism, and characteristic facial structure. Goiter. Goiter is an enlarged thyroid with decreased thyroid hormone production. An iodine deficiency in adults stimulates the proliferation of thyroid epithelial cells, resulting in enlargement of the thyroid gland. So the thyroid gland collects iodine from the blood and uses it to make thyroid hormones. In iodine deficiency, the thyroid gland undergoes compensatory enlargement in order to extract iodine from the blood more efficiently. Effect of iodine deficiency leads to a simple or colloid goiter. That means increased size of thyroid gland, which prevents by addition of iodized salts in addition to small amount of table salt. Children born to iodine deficiencies may suffer from hypothyroidism. Some vegetable foods like cabbage, carrot, turnips, peas, and peaches contain substances called goitrogens and can produce goiter if they are ingested in excessive amount. An extra intake of iodine prevents goitrogen, the effect of these foods. Now fluorine. Fluorine is solely derived in human from drinking water. Other sources of fluorine includes tea, salmon, sardine, mackerels. Keep in mind these salmon, sardine and mackerels are cold water fish that contains a small amount of fluorine. Recommended daily allowances. As per day recommendation of fluorine is about 1 part of fluorine in 1 million part of drinking water. Parts ppm, parts per million. ppm parts per million stands for 1 part of fluorine. The daily recommendation is 1 part of fluorine in 1 million parts of drinking water. Daily intake should not exceed more than 3 milligrams because it's a toxic element. Infants required zero point 0.1 to 1 milligrams. Children and adolescents required zero point 0.5 to 2.5 milligrams. And adults 1.5 to 4 milligrams. Adults individuals have a lethal dose if the dose of fluorine exceeded up to 2.5 grams. That causes fluoride toxicity. Now body distribution, absorption and excretion. In blood, 10 to 20 microgram of fluorine, mostly in ionized form, also present in signified amount in calcified tissues like bones and teeth. Absorption and excretion. Inorganic fluoride is absorbed readily in the stomach and small intestine and distributed almost entirely to bones and teeth. About 50% of daily intake of fluorine is excreted through urine. Now functions. The role of fluorine in tooth development and dental health as well as the role of fluorine in bone development. Number one, role of fluorine in tooth and dental development and dental health. Present in human tooth in traces amount. Fluorine helps in tooth development, normal maintenance and hardening of dental enamel and prevention of dental caries. Destruction of dental enamels and incidence of dental caries are widespread among both adults and children in areas where the drinking water contains less than zero point 0.5 parts per billion of fluoride. Areas, it means the areas where the drinking water contains less than zero point 0.5 parts per billion fluoride. Destruction of dental enamels and incidence of dental caries are widespread among both adults and children. Greater than 1.2 parts per billion fluoride in drinking water of infants and children may increase fluoride contents of enamel and dentine. Increased contents of fluoride and dentine may reduce calcium deposition in these tissues and may cause mottling of enamels in newly erupted permanent teeth. Discoloration that results in discoloration, corrosion, and stratification of enamels included formation of pits. Now, role of fluorides in bone development. Fluoride present in human bones in traces amounts. Very small amount of fluoride from food and drinking water promotes a normal bone development. It increases the retention of calcium and phosphorus. It means a normal intake of fluorine increases the retention of calcium and phosphate and prevents old age osteoporosis. If fluoride intake is excessive, may rise the fluoride contents of bones that stimulates osteoblastic activity and causes an abnormal rise in calcium deposition that increase bones density. अगर फ्लोराइड का कंटेंट डाइट डाइट से ज़्यादा हो तो फ्लोराइड बोन्स फ्लोराइड का कंटेंट बोन्स में ज़्यादा बढ़ जाता है कि ऑस्टोब्लास्टिक एक्टिविटी को स्टिमुलेट करते हैं और कैल्शियम की एबनॉर्मल डेपोजिशन करवाते हैं जिससे बोन की डेंसिटी इंक्रीज हो जाती है नाउ फ्लोराइड टॉक्सिसिटी फ्लोरोसिस biochemical changes and fluorosis fluoride toxicity excess of fluoride in water or diet or its inhalation is harmful and is considered the main cause of crippling disease known as fluorosis, called fluoride toxicity. Fluoride level in GI tract, blood, urine have been reported to be high in fluoride toxicity. Now, the biochemical changes seen in fluorosis includes mitochondrial damage, administration of sodium fluoride in dosage of 50 milligrams per kg body weight results in mitochondrial damage and release of keratin phosphokinases that indicates cellular damage. Action on enzymes. Increased fluoride concentration inhibits particularly the magnesium-dependent enzymes. It also leads to reduce the activity of succinate dehydrogenase. It also inhibits the glycolytic pathway enzymes enolase. Effect on protein synthesis. Increased intake of fluoride results 10 to 45% reduction in protein contents of various organs. For example, adrenal gland, cardiac muscles, kidneys, lungs, pancreas, skeletal muscle, spleen, stomach, testes, and spinal cord. Effect on steroid synthesis. Steroid production is impaired due to depletion of beta-hydroxysteroid dehydrogenase. This enzyme, beta-hydroxysteroid dehydrogenase, involved in steroid synthesis. Its activity becomes reduced if in case of fluorosis. Effect on collagen synthesis. Collagen contents becomes reduced in fluorosis and its biosynthesis adversely affects due to a reduced proline uptake. It means decreased uptake of proline while deformation of collagens. And the collagen results the collagen biosynthesis effects. Assignments from iodine and fluorine. At the end of discussions, you uh, allowed to discuss brief about the role of fluorine in the development of tooth and bones. What is fluoride toxicity? Fluorosis also enumerate the biochemical changes occur in fluorosis and give the biochemical importance of iodine, also give the effect of iodine deficiency.